You're listening to the Cancer Assist podcast. Wherever you are in your experience, we are here to provide help and hope as you navigate cancer prevention, treatment, and care. Hosted by Dr. Bill Evans and brought to you by the Cancer Assistance Program. Help when you really need it.
Well, welcome to the Cancer Assist podcast with your host, Dr. Bill Evans. Today we're going to talk about patient-centered care and resources for patients, particularly informational resources, with our two guests, Angela Djuric-Paulin and Victoria Chambers. Welcome, ladies. Just before I start the conversation with you, I did want to remind our listeners that the Cancer Assist podcast is brought to you by the Cancer Assistance Program based here in Hamilton, Ontario. The Cancer Assistance Program provides a variety of free services to cancer patients, including free rides, equipment loans, nutritional incontinence supplies, amongst a whole lot of other supports for cancer patients. And these podcasts are made possible by donations from individuals in our community, with the hope that as you learn more about cancer, its causes, current best treatment approaches, and the supports that are available in our community, it will make the challenge of dealing with cancer just a little easier. So we're going to start with you, Angela, about patient-centered care. Now, as an oncologist, I would have said through the years that I practiced and saw patients in the clinic, I practice patient-centered care. What's this business of patient-centered care? How is it different than what maybe doctors think it is? What are the dimensions of patient-centered care that we're considering now that have been overlooked in the past?
Thanks for the opportunity to explain what patient-centered care is. So a part of the role that we have within the Regional Cancer Program and Ontario Health was looking at how do we really, truly bring the patient to the center of care. We talk about patient-centered care, and as you said, everybody makes the assumption we're doing it, but there's so many different avenues and streams where we need to look at. So part of that is looking at the symptom management of a patient. So coming in for treatment, and the focus of the clinical team is the assessment, the treatment, how to get patients best possible care. But along that line, we look at the stream of their symptoms and how are they managing those symptoms, and are they able to manage day to day and function with good quality of life while they are receiving their treatment. Another component of that is looking at their psychosocial opportunities and supports and services available. So as we think about the emotional support, so again, symptom support, emotional support, nutritional support, family support. And then another stream comes with the education component. So ensuring that there is resources that will support individuals and their families across the journey. So do they have the patient education material that helps them to go back and review the information they received in a clinical visit? Was there an opportunity if they needed to call somebody? Can they go back to a document, an information sheet that will allow them to know who they need to call, what information is important? And so it's really putting the focus on almost like a hub and spoke model. So the patient's at the center of the care, and then there's so many different areas and aspects of that care that go beyond the clinical treatment, the medications, the radiation, a patient showing up for their chemo appointment or taking their chemo medications orally at home. What supports and services do they need for that component?
So it's a lot broader than what most clinicians have time for in a busy clinic visit. And let's face it, usually the patient's seeing the doctor for a few minutes. So touching on all those different aspects would be extraordinarily hard while trying to manage the complexities of modern cancer treatment, right? Care has become so much more challenging to deliver. So I think the technical aspects are probably managed very well, but less awareness of how the patient's actually coping with the illness, how the caregiver is coping with the illness, what the symptoms are and how they've been changing over time. So all of that's tremendously important. And then how well they understand their disease. And in one of the previous podcasts we did, when we were talking about the book, what's it called? It's Plan for the Best, Hope for the Best, Plan for the Rest. There, I got it. It really was the patient having a good understanding of the illness, so that they're much more prepared to make appropriate decisions for their own care. And so, Victoria, you run the Patient Resource Center, and we'll call it a library because maybe that's makes it clearer to people exactly what's happening. So resourcing people with evidence-based information is really rather important so that they can make good decisions with their doctors, right?
Oh, it definitely is. I mean, that is just one of the questions that I get. There's just such a wide variety of questions that people have. I get people coming into the library who have first been diagnosed and are looking for information. They've never heard of this particular type of cancer before. And then also people who perhaps might have a second occurrence, or someone who has been coming in for years, but looking for information like previous person that you've interviewed, one of the child life specialists that we have. So people are looking for information about talking to their children about cancer. Also caregiving, as you touched upon, Dr. Evans. So we provide resources such as we have a full lending library. So that means lots of books, CDs, DVDs on not only particular types of cancer, but things surrounding caregiving, talking to children. We have children's storybooks. Another popular topic is people are wondering what they should be eating while undergoing treatment. So our nutrition books, our recipe books are very, very popular. I try and keep that collection up to date. I'm always looking for the latest publication, but I'm also adding new books such as the one you just mentioned, Hope for the Best. Current topics, obviously, around cancer.
So quite a wide variety of media in order to meet the various needs. But I guess one of the challenges is people come with different levels of, we'll call it health literacy, or maybe just dependent on their educational backgrounds, that some people would expect very sophisticated information. Some people wouldn't even know what a cancer is to start with. And that must be one of the challenges, to meet them where they are in their ability to understand, and based on what education they have and prior experiences. How do you manage that piece?
Definitely. It's coincidentally, October is Health Literacy Month, so it's fortunate that you mention it. We're fortunate to live in such a day and age where, I'll give an example. I had a patient come in and she had trouble with reading, her reading level, literacy levels. And so she admitted that to me, and I found some information, a video about leukemia for her online, and she was able to listen to it in our library. We have 3 public access computers, in addition to all the books and resources. So I was able to play the video for her, and she was better able to understand her diagnosis, the possible treatments. I also have been asked numerous times for resources in other languages, Korean just being the latest example. And so I access all the various websites. I make phone calls. Fortunately, there are a number of resources in other languages these days. So we're very lucky to have those.
I haven't really thought about that, but as soon as you say it, it's so obvious, isn't it, that we're such a pluralistic society that you've got to deal with people from all sorts of nations and immigrants to the area who may have a different language in which to provide the information in. So, and that makes your job a tad more complicated, I think.
It does, but once you've been asked, about a certain language, I've kind of put together a bookmark my favorites, and there's, a number of different sources. So it's wonderful to have that at my fingertips, and then I do have this lung cancer information in Chinese. Here you go, or Mandarin, or.
Excellent. Great to know. And Angela, your role is regional. So as we're talking about person-centered care, there's multiple other institutions in our region, and so how are you trying to evolve patient-centered care in Brantford and St. Catharines and Burlington at Joe Brant and those other organizations that are part of the regional network?
Thanks. Great question, and we're always looking for that opportunity. We work very closely with our partners within our regional program. So as you mentioned, we've got Joseph Brant, Brant Community, Walker Cancer Family, as well as the Juravinski Cancer Center. We have what we call a person-centered care collaborative program, and we meet every other month with our regional managers, the directors. Our patient family advisors are part of that committee, as well as our psychosocial team. And within the program, we discuss key areas where we'd like to see advancement. So as we're working on education development, our patients are flowing through each of these areas. Some may start at one of the cancer programs and end up at another facility, and we want to make sure that the education resources are available at both consistently. Symptom management is one key area that we've worked very closely with our regional partners to develop and enhance, and sharing education that's developed. We may develop it at one site, do some testing and trialing, and then we work with our regional partners to then spread that information across. We also look to see where there's opportunities to enhance as part of the patient education component. A lot of education is developed in-house, so as Victoria was saying, a lot of the information validated, we have information. The in-house education resources are critical to ensure that they are easy to read, they are understandable, they provide direction, and to support us with that work, we use the keys information is from our healthcare providers, and then we engage with our patients and families to review the information and let us know, were they able to understand it? Was it easy to read? If they had no knowledge of this illness or subject, would they now be able to manage their symptoms? Would they be able to manage knowing who to call or when they needed to seek additional medical information? So we're really fortunate that we have this program, and we are looking to develop a pilot where we can standardize it across the cancer program and hopefully across actually the whole organization of Hamilton Health Sciences. So it's a very new pilot, and we're excited. It is at the cancer program, we have 9 patients and family advisors who are supporting this work, and Victoria and myself, as well as Sandy and Lisa, 2 of the librarians, are kind of co-leading this work, but the drivers really are our patients and family advisors.
And there is a patient and family advisory committee you have at the Cancer Center. Did the other sites also have so-called PFACs with the patients providing input to the processes in each of the other sites?
The other sites do. However, they're not fully oncology focused, whereas the Patient Family Advisory Council at the Juravinski Cancer Center is very oncology focused. And with that, we also have a few PFAC members who are a part of different committees from Walker Family Cancer Center participating in regional programs and supports. We're looking to see how we engage more broadly with our community partners to expand so that it's not just a smaller, isolated group of our patient family advisors. So, we work closely with our community partners, but we need to figure out how to better engage with our community partners. So that's kind of one of our key initiatives moving forward this coming year.
But to me, it's music to my ears because it's great to have a cancer center like the Juravinski. It has a lot of expertise and so on. But if patients are being seen in other institutions around our region and don't have access to the same levels of supports, of information, and so on, it seems to me having almost a 2-tiered system. And what you're obviously striving to do is to make sure everybody because not all patients are going to come to the Juravinski. They may have their surgery done in Joe Brandt, and that's all they needed, and be followed by a medical oncologist, their surgeon there, and don't need any time at the Juravinski, so to speak, but they need to have the same kinds of supports and in education and psychosocial supports. One of the challenges I recall was in implementing symptom assessment, so-called ESAS, which stood for the Edmonton Symptom Assessment Scale or System, officially published as the system. I think you're calling it Your Voice Matters now, which
Your Symptoms
or
Matters.
Your Symptoms
Your
Matter.
Symptoms
Okay.
Matters, yes.
Yes. Well, I think that is more understandable to patients than ESAS. It was a challenge, I think, to get patients to routinely complete them, and maybe a bit of a challenge for doctors to look at them too. And how is that all going? Because it seems to me, I can just say, I'll confess that as a lung oncologist, I was really surprised to see the level of psychological distress in lung cancer patients that I did not appreciate through my years of practice. I really didn't. And I just say this, I'd love for physicians to take it much more seriously because they might be surprised. Patients often put on a better face in the clinic than what they're feeling and acting at home, right? And they don't want their doctors to feel that the treatment's not working, so they sound upbeat when maybe they're severely depressed. And we could be doing more to help them. So are you making gains on getting patients to complete them, or is that still a challenge?
It's still a challenge. We have our ebb and flows where we seem to be really gaining momentum there. And then, like everything, unexpected things happen within healthcare systems and teams, most recently with the pandemic. So within our regional cancer program across, prior to the pandemic, we were seeing 70 to 75% of our patients completing their symptom screening assessment prior to coming into their clinic. The pandemic came into our world, and things had to change. And so access to the equipment was something that was a concern for infection control. So the on-site devices were shut down, and patients weren't able to access that information. Ontario Health was instrumental during that time and created what was called a home channel. And it was a link that allowed patients to complete it from their own personal devices. A cell phone with data. You would be able to open up the link and be able to go directly to the symptom screening assessment. Now you're using your own device. And again, education, communication, getting that information out across both the clinical teams as well as our regional partners, patients and families. So we did see a gain and momentum shortly after the implementation of the new link. And then, as with everything, some more challenges along the way. A new electronic health record put in place to enhance access and communication across the program. Clinicians rightly needed to focus on being able to manage that system, treat patients. And so now we are back into a point where we are stable with that ability. Everybody's comfortable with the new system. And we are re-looking at how do we strategize to engage with the patients and families to start making sure that's a part of the process. And it's really important that it's seen as a part of a check-in process. So a patient is coming to a clinical visit. They're not only bringing their health card, they're bringing their medications, and they're completing their symptom assessment. It's a great tool that allows the communication and the language to be consistent. So if a patient is talking about how they're feeling around their appetite, or they're being nauseated, having difficulty with shortness of breath, their clinical team is using the same language, the patient is using the same language, and now you're ensuring that everybody is really communicating effectively. It's a great opportunity to see any changes and small changes to be able to trend for the clinical team and to be able to add interventions earlier. And that is really the most important component of doing it. It's, patients will say, I have no symptoms and I'm doing great. Why am I doing this every single time? But the minute that there is a change, the healthcare team is able to see it and have a further conversation around it. And there's so many things in such a short period of time that the clinical team is accomplishing with the patient and family. Talking about their treatment, answering any questions that they may have, planning the next steps of their care. It allows the opportunity to focus in and say, wait a sec, I noticed that you mentioned you're really tired. Your score has changed. Let's talk about that. What can we do to support? What information? Is there an opportunity that we can give you some tools that will assist and help you? So it really is an opportunity to allow the patient to focus in on what's important to them for that appointment and that time, while the clinician is also focusing in on what's important to move the patient through their care.
And this is a blunt question, but are the doctors and nurses taking note of the ESAS scores all the time, or are we still challenged a bit in terms of how they use that information?
So they're like everything with the system, there's challenges. With the new electronic health record, one of the benefits is that the your symptom assessment has been built into one of the flow sheets that the nurses go through. Okay. So if a patient actually hasn't completed it, as a part of the assessment and the conversation, the nurses will go through that. Not every clinical encounter will have a nurse with the patient, so there's the opportunity for the physicians to then further engage in reviewing and seeing if it's been completed. If it hasn't been completed, again, being mindful of the time and the period and going through, because the clinicians are great at doing their assessments and looking at and discussing symptoms. It's a perfect opportunity for the clinicians to provide a bit of education so the patients are aware and the importance and the value for the next time that they come into their clinical appointment. So it really is a constant conversation. It's not one and done. It is every time you're coming into the clinic visit, asking, checking, validating, and really re-instructing a patient and really showing them how important it is. So it's asking, appreciating, and acknowledging. And I think those are the three key things. If all of the healthcare team remembers to do, it will engage with the patients and their families. You ask about it, you acknowledge it, and you discuss it. So,
yeah, I think it's terribly important, and that's why I'm sort of belaboring this point. And for listeners, particularly for patients, it's so important to complete that assessment each time, because those little changes can dictate how your therapy might need to be adjusted or other things introduced that would help you along that journey. So I know that there's a certain fatigue that happens when you've been doing it for a while, and it's just something we want to see the culture change within the cancer center so that it's just part of the regular rhythm of doing things so that we can do the best job for the patients, and back to being patient-centered, right? It's all about. So you mentioned how COVID and the pandemic impacted, and I'm sure it's impacted the delivery of information resources, because I imagine people weren't coming into the library to get hard copies of printouts or books or whatever. So how did you adapt, Victoria, to the provision of information resources during the pandemic?
Well, luckily, I'm proud to say that we were only closed for a couple of months, and then we reopened the library. So I just undertook a lot of infection control measures. So any books that were borrowed, we made sure to sanitize them before putting them back on the shelves. There was a bit of a quarantine period, like of a day or two, and then wiping them down and putting them back. Paper resources, we had the rule if they were picked up, then please take them or recycle them. Don't put them back down. Whereas normally we would encourage people to sit down, linger perhaps, spend some time. We just had an in and out policy. We were limited to 2 people at a time, that sort of thing. Luckily, that's over with. But during COVID, I did receive more emails, I would say phone calls. And for the most part, I would say 85% I see people in person. But during COVID, yes, there were more email requests as well as telephone calls. And luckily in this day and age, I'm able to forward a lot of information online. Definitely, for the most part, people do have an email address that I'm able to forward the information.
I was going to say we should talk about the QR codes that we developed to support patients. So that was something that during the pandemic, and we continue to, is we developed QR codes to make it easier and accessible for patients. So they didn't need to, type in a full link. They would be able to, if they had access to a device, they could just scan a code. It would bring them up to information on the library. It would bring them up into information around survivorship. If there was a discussion or a request for palliative care, all of the resources that were available, identified by the communities. So we weren't, again, just looking in the Hamilton area. We were looking at all of our partners, so out to Niagara, to our Burlington area, supports and resources. And they became one of our staples. And now as we develop all of our patient education materials, we ensure that we've not only have the links so it's accessible to patients, but we have included a QR code to make it easier. And not all patients, we appreciate, not all patients are technologically able to do it. They don't have the devices, but with the support, so they can get paper, or they've got the paper with these access codes that their family members, it could be a grandchild, a sibling, yes, who would be able to help and support. And then, that broadens that knowledge base because, I've got this information, but I don't know how to access it. You're asking one of your family members. Now you're engaging in further conversation and education and knowledge spreading across. And you want to talk about the library QR codes that were developed?
Maybe just even for those who don't know what a QR code is, it's those funny little squares with the black and white patterns on them that seem kind of random that you put your phone to and then up pops a link and you click on that and you get taken to resources. We're finding in a number of situations through the Cancer Assistance Program, also on the hospital board that I'm on, a lot of people don't know what they are, and therefore we're not getting them as involved. So a little bit of education around QR codes is going to be necessary. I'm sure they're definitely the way of the future, but we've got to bring everybody along. Yeah.
We're with ours because that was a concern that we had. So we literally, right above it, provide directions and with an explanation. What is a QR code and how do I access this? Again, because not everybody's comfortable using them. And we took the opportunity. We are really fortunate that we get some co-op students periodically within the Patient Family Resource Center of the library. And we did take the opportunity to have our co-op students support patients coming in with the symptom screening because we developed a QR code there, as well as the patient education library information. So having our co-op students educate patients, spend time because they have the time to meet and greet patients as they were coming in, talk a little bit about the symptom screening in the library and how to access a QR code, how to link into the hospital Wi-Fi if they didn't have data. Because the hospital put in free Wi-Fi during the period of time of COVID. They still have free Wi-Fi for guests. So not everybody has, data on their phone that they can use. So showing them how to access their data and then link into the hospital system's data so then they can pull up information. So again, it was looking at all of the steps that would be required. It's great to say, please do, but we needed to remember that not everybody is comfortable with technology. So how do we help and support and educate so that we can get patients comfortable and their family members comfortable with using it? And again, very much paper-based still. I know we talk about trying to get away from paper, but Victoria and I also appreciate how important paper is for our patients and families. So with the resource, they may do it electronically, but they like to have that piece of paper in hand.
I understand perfectly. I'm one of those people. But it's really fortunate we have the technology because I don't really know how we might have got through the pandemic were it not for the various technologies that have been enablers to continue to provide supports, educational materials, et cetera, et cetera. It really was fortunate that, and can't forget Zoom, all the things that we've had to help us get through the pandemic. Look, we're going to take a brief break now, and we'll be back to talk some more with Angela and Victoria about more of the supportive care measures that are available at the Juravinski and through the Regional Cancer Program, and we'll be right back.
We'd like to take a moment to thank our generous supporters, the Hutton Family Fund and Banco Creative Studio, who helped make the Cancer Assist podcast possible. The Cancer Assistance Program is as busy as ever, providing essential support to patients and their families. We remain committed to providing free services for patients in our community, including transportation and equipment loans, personal care and comfort items, parking, and practical education. These services are made possible by the generosity of our donors through one-time gifts, monthly donations, third-party fundraising, corporate sponsorships, and volunteer opportunities. Visit cancerassist.ca to see how you can make a difference in the lives of cancer patients and their families.
Well, welcome back. We're talking to Angela Djuric-Paulin and to Victoria Chambers about various supports in our community and at the Juravinski Cancer Center that really revolve around patient or person-centered care, the educational support, the symptom assessment and support for the various symptoms cancer patients can have. And if we're doing it really well, I guess we'd have a lot of satisfied patients. And one thing we need to know is, what do the patients think? And how do we get that feedback I know a lot of centers have, I guess all the regional cancer centers have patient and family advisory committees, so we get some direct feedback from a limited number of people. Then there's also trying to survey the patient population with satisfaction surveys, and I gather there's a new survey tool that's been it comes from Ontario Health to measure patient satisfaction. Maybe you could tell us a bit about those things, Angela.
Sure, absolutely. There's a patient feedback survey tool. It's called Your Voice Matters. It aligns with the Your Symptoms Matters tool, so it is also done on the web-based platform, and patients are able to provide feedback around their clinical appointments, their wait times, understanding the next steps, were family involved, were family engaged and asked to be involved, and that's every 30 days. So when they're coming in for their appointments, every 30 days they would be asked to complete this. It takes between 3 to 5 minutes. There's 14 questions, and it's an opportunity for them to share their feedback, to let us know and let the clinical teams know how they're doing. Everybody strives to do their best, but as we know, there's always opportunity where we can improve, and it will allow teams to see where we do need to improve. Sometimes it's around our, wait times, check-in times. Sometimes, especially during the pandemic, family members were limited, so there wasn't as much engagement and inclusion there. And we're working really hard to get back to where we were before. And, things do change, but maybe there's an area where we need to focus a little more on. Our regional partners are involved with the Your Voice Matters. Two of our sites, the Joseph Brant site and Brantford General site, weren't using the Your Voice Matters. However, they will be launching it this fall. So all of our regional partners will be using this program. And it's just a great opportunity. It doesn't take too much time. And it just lets our clinical teams and our allied health know. So, our clerks, our healthcare aides, our dietitians know how things are going within the program.
So how is the information from the surveys sort of distributed to staff? Who gets to see it? You mentioned a lot of frontline staff there. That sometimes it's just management looks at it and buries it or something. But it sounds like it's widely distributed.
Such an important question. So a couple of really important pieces of information for both Your Symptoms Matters and Your Voice Matters. The information is all confidential. The Your Symptoms Matter information does go into the patient's electronic chart. So the information is put right into the patient's chart, so the clinical teams have access to that information. It is all kept private and confidential. There's no concerns with privacy areas and issues around that. Your Voice Matters is a bit different. That information does not go to the patient chart. That information goes directly to Ontario Health, and Ontario Health then keeps that data very private and brings it back to each of the cancer programs, and it's called aggregate data. So the information, there is just, if there's a question, so your wait time, were you satisfied with your wait time? Yes, no. And 100 people answered that question. That information would come back as a score. There would be no information as to what patient gave that information. Yeah. Absolutely none. And I think that's really important. And I know it's a concern, especially with this day and age with everything out there electronically, social media. And sometimes people are hesitant to complete that information for fear that if they were unsatisfied with the wait time, and they may fear that this may go back to their clinical team. Now their clinical team knows that they were upset about the wait time, and the fear of it may impact the relationship or the care they received. So it's really important to stress the information does not come back directly to the clinical team in any format that they would be able to say, oh, so-and-so created that information. And it's just a way of knowing how you're doing. The symptom management, though, is different because that is a part of your care, and it's important for your healthcare team to know and understand how you are feeling and how you are doing.
Right. Makes perfect sense. And I think it's very reassuring that the information that is captured in the patient satisfaction surveys is just anonymized and you're not identified, but it's the, as you said, aggregate data that's coming back to the center so they can see how, in a general sense, how the center is performing. If the wait times are becoming long, which they're measuring anyway, they'll know. But if the patient's complaining, then adds further weight. So we've got to do something to improve the problem. Victoria, there's something that you mentioned, I think, about a Pathfinder series, which I gather is sort of very specific to patients' needs. Maybe you can kind of fill that out so it's a little more understandable, at least to me.
Of course. So Pathfinders are sort of like information guides. They're topic-specific guides for reliable resources. They kind of act as a starting point for your information-finding journey. So the Pathfinders that we have, I have about over 40 of them. They are accessible on the Patient Family Resource Center web page, which is accessible via the Hamilton Health Sciences website. And so some Pathfinders are about different types of cancer, so breast cancer, colorectal cancer, head and neck cancer. Other topics include things like cancer during the holidays and how to manage, genetics in cancer, sleep issues, sex intimacy and cancer, returning to work, or life after cancer. So what they are, the print guides that are available in the library at the Juravinski, the front page mentions books that we have on our shelves, and then the opposite side has reliable websites. So everyone's heard of Dr. Google, going in and just typing a few keywords, but then some of the results can be alarming. You don't know if they're credible, if they're reliable, current. So using these guides, these Pathfinders that we've created, you know you're getting the most reliable information, the most current information. Just a few, to name a few, I would recommend, if anything, I'm going to leave the listeners with, is if you're, diagnosed and you're looking for information, I would say find the credible association or organization. If you've been diagnosed with ovarian cancer, go to Ovarian Cancer Canada. If it's Lung Cancer Canada. And those are the kinds of websites that are available on these Pathfinders. Now, everyone hopefully has heard of the Canadian Cancer Society, and that's another one that I would recommend, as well. Just going there and just starting with a reliable source and then maybe extending your search from there, but not just typing it into Google.
Good advice. How many people can you estimate of all the cancer patients, how many want that depth of information? Because some people are really hungry for information and others say, Doc, you're the educated person, you tell me what the best treatment is, and don't want to go searching for more information. Do you have any idea of what the distribution is of patients by?
That's so true. But I would say I see the people who want the information, right?
Yes,
the people I think who are not stepping into the library, the ones. That being said, I've had a few people come in and just want the basics. Perhaps they'll just leave with the Pathfinder or one or two documents. And then I have the people who want 10 books on the subject and every single, flyer that I have, and then some they don't. They might pass on to family members or something like that. So I would say for the most part, I'm 90% of the people who come in to the library want everything they can get their hands on about the topic. I also get, we spoke about caregiving earlier, I will get a lot of spouses as well, or, siblings, parents who want information. So sometimes it's not necessarily the patient who wants the information, but it's a caregiver or a loved one who wants that information, and they're the reader in the family, let's say. I've joked with a number of wives and I kind of can relate to them, and I say, I'm the reader in the family, not my husband. So, and so it's generally I get the readers who come in, or the people, the information hounds, for lack of a better word.
Well, the caregivers are often forgotten in the whole process in terms of their needs, some of which is information, so they have a better understanding of what their spouse is going through or their partner is going through. But also they have specific needs because they're burdened with it's an emotional burden to care for someone in the home, particularly if a person is not doing well and has a lot of physical and emotional needs themselves. So then the caregiver gets a burden passed on to them. So there must be, in the patient and resource center, there must be sort of special information aids for caregivers, I would hope.
I do have an entire shelf. So the way that the library is organized, obviously, our book collection, organized by topic, and definitely we have a lot of caregiving books for caregivers who come in, as well as I have a number of shelves, and I have an entire shelf dedicated to caregiving. So obviously, I have a caregiving pathfinder, so that'll mention the websites that you could visit, the books that are available to be borrowed, as well as things like there's the Ontario Caregiver Organization, so I have their brochure. Other organizations, for example, Leukemia and Lymphoma Society of Canada, Myeloma Canada, they have their own specific kind of caregiver guides that I provide in print if people are not able to go to the website and access them electronically.
Sounds like you're very well resourced for caregivers. So maybe it's more an issue of making caregivers aware that within the patient resource center, there's a place for them as well to access their needs. So that's great. And then you're launching into something, Angela, I gather, a patient education series. It's being planned or in motion. So where are you in that? And let's talk about that for a minute.
So we're going to be collaborating with the psychosocial oncology team. Dr. Karen Zhang is taking the lead on this and developing some patient education series that will be available online. For some of the key topics, so nutritional support, psychosocial oncology, and so it will be a pilot once it rolls out. We're hoping that it will be in place January, February, and with that work, our collaboration is ensuring that we have adequate resources within the Patient Family Resource Center, the library, to support patients who are attending these sessions. And so that if they've got more questions, they're looking for more information, they'll be able to come into the library and find that. So it'll be a great topic, and Dr. Zhang would be a great person to have on the podcast to talk a little bit more about this, and we're very excited to be collaborating with her.
So is she doing it with a group of patients, or is it something she's preparing to, like a podcast or a webinar? How is it going to work?
Right now, it would be patients who are interested would sign up to participate in the session. It will be done most likely by Zoom, I believe, right now, unless the platform changes. And so that it will, a larger audience. And there's, with every resource, you have to look at ways to expand and be able to have as much information available to as many people as possible. So this is a way for key items and common topics that patients, families are interested in to get at least some foundational information out. And then from there, additional questions and spending more time being able to answer those questions and support patients. But it's almost like starting a foundational conversation and providing direction. And that's that key. Where else do I go? What other information do I need? What are my gaps? Where, who can I talk to? And so the collaboration with our education department as well as the psychosocial oncology team made great sense, because it starts the conversation, gives initial information, and then anything else that people are looking for, we'll be able to support with that.
Well, it strikes me from this conversation that you have an awful lot of things going on and a lot of great supports for patients, and the efforts to truly make care patient-centered are obvious. It's a challenge because there are lots of things that tend to get in the way, and one of them being lack of time to do everything as well and as thoroughly as you'd like for each and every patient. But with a variety of resources, you're really having an impact. Maybe just in closing, what messages would you like to have our listeners hear about what you're doing, or what you think really makes a difference, or what should they be doing to maximize the benefits of all the resources that are available through the Juravinski and the regional program?
I think the first would be talking to their team if they're not aware of their symptom screening assessment, asking for support on how to complete it, engaging with the team, their families, us in the resource center to support them with doing that at each of their clinical appointments. The second would be really so that there's awareness of the resources and supports. And I think a lot of times the information is available, but not everybody is aware. And as you mentioned, there's so much to be done in such a short period of time. It's how do we get that information out? So Victoria and I are available in the Patient Family Resource Center Monday to Friday, 9 to 5. I'm usually there a little bit later, so sometimes people will pop in, but I'm there, and being there to support and assist them with any of their questions. Victoria is phenomenal at doing literature searches, and so if there's a question we can't answer, then we will find that information. So we really just want people to be aware that we've got these resources, we've got the supports and services to come in and visit us. We're right at the front doors across from the lab at the Juravinski Cancer Center.
I'm glad you mentioned that, because I meant to ask you, where are you located?
Yeah, as you come in the front doors of the Juravinski Cancer Center, if you turn, you look to the right, you see the lab. If you look to the left, you'll see our door. It's always open. And it's available for not only the Juravinski Cancer Center patients, but our regional community partner patients. So should they want to call and ask for information, we can pull it so that they can come and pick it up. Or there's information available online, and Victoria will direct them to that area. But it's the awareness that, we are here, we are able to support and obtain the information. And I'll pass it to Victoria to add.
Oh, my final thought is just welcoming everyone to the library, and hope they will seek us out. And I just wanted to mention, in addition to all the information, I would like everyone to know that it's a quiet and comfortable space. I have had all sorts of people come in, people who are first diagnosed, just need a quiet minute to themselves to absorb kind of the shock of receiving the news. Parents will come in with little ones looking for the storybooks to talk about cancer. I have some coloring books and crayons. Sometimes people are waiting for grandma to finish her appointment. We have comfortable seating space, plugs. I've had people charging their phones, or they don't have a device, they need a computer to use. So it's just more than just the books and the paper. I believe it's a welcoming atmosphere. I've had more than one person ask for cuttings of my plants. So I pride myself on my green thumb. And so I just find that it's sometimes the atmosphere, not only just the information, and sometimes a listening ear. I have no social work background. I don't claim to be, have a medical background, but I think that I'm a good listener. And sometimes what people need is the box of Kleenex in the center of the table and just a listening ear. And so I hope I can provide that.
Well, there's been a lot of listening ears today to both of you, and I think the information's been amazing, and I hope people will truly access it, whether it's the symptom management piece and completing those Your Symptoms Matter that you've emphasized, Angela. It's so important, and then all the resources that are available through the Patient Resource Center or library. So as we close out today's podcast, just like to remind our listeners that there are many podcasts available through the Cancer Assistance Program, going to the program's website, cancerassist.ca. So I think there's about 40 plus podcasts there on different types of cancer, on the supports that are available in our community. So avail yourself of those. And thank you to our two guests, Angela, Victoria. Thank you so much for sharing all your knowledge about the efforts to make care in our region truly patient-centered. Thank you so much.
Thank you.
Thank you for listening to the Cancer Assist podcast. Find more episodes, resources, and information at cancerassist.ca, or follow the Cancer Assistance Program on Facebook, Twitter, and Instagram. We'll see you next time.